What is a gastric band? Many of you have heard of a gastric band, have seen it maybe as a picture, but what is it and what does it actually do? The gastric band's been around for at least 40 years and many thousands, hundreds of thousands even, have been put in around the world. They were very, very popular in the early 2000s and many patients absolutely swear by their gastric band. It's been their saviour and has helped them lose loads of weight. And if they're looked after properly, many patients are absolutely delighted. The principle is that you've got a rubber ring like this with a balloon around the inside, and that's connected via a long tube to a flexible port that goes under the skin on the front of the tummy, and that allows us to put a needle into the port to blow up the band, the balloon inside the band, with a bit of salty water, some saline. And that allows the band to squeeze on the stomach and cause restriction of the flow of food down the gullet and the stomach. So here's a stomach. What we do is we unclip the band, put that on the stomach, clip it together like so, and then tunnel the port to where it needs to be on the front of the tummy. So you can see the gastric band sits just below where the gullet enters the stomach. You've got a tiny little stomach pouch at the top. So as food goes down, it has to traverse this narrowing, and that narrowing is adjusted by the port depending on what kind of foods the patient can manage. If you can manage a lump of bread or an apple or a lump of meat, then we tend to tighten it a little bit so that you have to really chew and take things slowly. If it's too tight and you can't even get sloppy foods down, then actually we need to take some fluid out and release it. And this is one of the advantages of a gastric band. It's adjustable. It means that throughout your life, because a band can last for a lifetime, you can have the band tighter or looser depending on what you want. The band works really well for people who just don't have an off switch. They just eat too much food. And it's generally meal time. So people who have big portions, who like their savoury foods and eat a lot, band works well. It doesn't work very well for people who are pickers and grazers, who eat loads of little biscuits, sweet foods, etc., because they will crunch down to nothing and slide straight through the band. Doesn't matter how tight you do it, they'll get in. So chocolate, ice cream, all that kind of stuff doesn't work well with the band. One of the advantages of the band, again, is that if for any reason it doesn't suit you, you don't like it, we can just go back in with surgery, unclip it and remove it. So it is a reversible, in inverted commas, procedure. There will still be some scarring around the stomach where the band used to be, but generally that's not a problem. Occasionally you may hear the phrase slippage of the band. The band has slipped, and that means the band has actually gone down the stomach a bit, or actually the stomach comes up through the band and you have a much bigger pouch above the band, and that gives rise to acid reflux, which is the cardinal sign of the band misbehaving and slipping. So patients who've got acid reflux after a gastric band need to come and see their specialist or us, and we will do the right test to show what's going on. If the band has slipped, sometimes we can reposition it, sometimes we can't. We have to just remove the band and consider changing patients over to a different operation. The gastric band's a very simple procedure to recover from. Most people are now having it as a day case, so you come in the morning, have your band, you'll be home in the evening, and return to work usually within a week or so. The band isn't inflated when we first put it in, but over the course of 3 or 4 weeks, everything settles down, the healing is established, and we can then start to gently fill it over 3 to 4 months while you adjust your diet. Once the band is at the right tightness, which takes 3 to 4 months, you will then start to lose weight as your daily food intake is reduced by the band slowing down your eating, making you feel a little less hungry. Weight loss with the band is slow and steady. People lose no more than 2 to 3 stones in their first year with a band. After that, I would expect no more than 1 to 2 stones a year, but it's steady and it's cumulative like that. Unlike the bypass or the sleeve, where the weight loss happens all of a sudden in the first year or two, and then no more after that. If anything, there's weight regain. That does not happen with the band. You lose your weight slowly and steadily, year on year, until you reach a plateau where the tightness of the band matches your lifestyle and your food intake. So it's a good operation in the right patient, and in patients who understand how it works and understand their job in making it work and working with their new tool. That's the gastric band in a nutshell. Any more questions, call Streamline and we'd be happy to help.